Chapter 81 The Teacher is Really Handsome. You are listening at novelfull.audio. It can't be such a coincidence, right? Su Chiu received perfect debridement and drainage surgery for pancreatitis and Chen's pancreaticogynostomy yesterday. These two surgeries. It is for pancreas-related diseases. Ordinary acute pancreatitis is not needed. Preventing and treating shock, applying antibiotics, and doing peritoneal lavage in severe cases are enough, and Su Chiu got these two surgeries. On the contrary, it is more suitable for severe acute pancreatitis. I hope it doesn't come to that. Su Chiu shook his head. Severe acute pancreatitis has a sudden onset, many complications, extremely poor prognosis, and a mortality rate as high as 20% to 40%. Once the disease occurs, the cost of treatment is also quite high. Hundreds of thousands is considered an average, and some patients can even spend millions. Thinking of this, Su Chiu simply said it clearly, saying, after the examination, if it is confirmed that it is acute pancreatitis, it can be cured for as little as a few $100, or even $1,000 more. But if it continues to be delayed and it worsens into a serious disease, it will cost dozens of dollars. You may only see a little splash if you drop it. MaleProtagonist promised well and said, okay, we will check it out soon. As a result, after Su Chiu left, he put on his shoes neatly, grabbed the steamed bun next to him and left. His wife stopped him. What are you doing? Didn't the doctor say? Afraid? What are you afraid of? When have you and I not been like this? But the doctor said that if it can't be cured, it may cost hundreds of thousands of dollars. MaleProtagonist laughed loudly and said, daughter-in-law, do you believe this? The doctor is just scaring you. I just worked too much overtime in the past 2 days and ate too much. In addition, I drank too much with Lao Chen and Lao Yang last night, so I got stomach trouble again. As he said that, he felt another stabbing pain in his lower abdomen. He closed his mouth and squatted down, and the pain eased. The wife was frightened and said, husband, listen to the doctor. Anyway, I have saved so much money. What nonsense are you talking about? The two of us saved the money together at the construction site. How can we use it randomly? When you return to your hometown, I will build you a 3-story villa. Hurry, let's go, don't waste money. MaleProtagonist said, dragging his thin wife and leaving. When next year, when they have saved enough money, they will be able to leave this soulless concrete forest and return to the beautiful countryside. MaleProtagonist felt very satisfied and said, when the time comes, the last time we go to the construction site will be to build our own house. I will organize a glorious wedding for you. When he went to work in the afternoon, Su Chiu looked at his daily tasks as usual. Simple task: participate in a rescue operation. General task: perform a case of scrotal suturing. Difficult mission: save a life. Today's task is not easy. Su Chiu asked Lu Susu to help pay attention to the patient with broken cyst, but there was no movement all morning. Su Chiu didn't hold out much hope either. Those who can rupture the sac usually have other more serious injuries. For example, in a car accident, the entire thigh was broken and the scrotum was also scratched. How can such a patient have the time to deal with a bag? Lives matter, unless, I was spotted and bitten by my girlfriend. When it comes to saving lives, Su Chiu estimates that only patients with at least red-level I critical condition can barely save a life. However, at this moment, he thought of MaleProtagonist in the morning. Su Chiu called Chen Xiao and asked about the situation. Chen Xiao quickly went back to take a look. When she came back, she had $200 in her hand. Teacher, there is MaleProtagonist's information in the admission record, but, he is missing, and there is still money on the bed. Su Chiu realized something was wrong and quickly looked at the expense list. Bed 35, MaleProtagonist, amount to be paid, 196.3 yuan, payment item, pethidine. He called Lu Susu and asked about the situation. Lu Susu thought about it for a long time before saying, it seems that 35 beds came to ask about the fee in the morning. I checked and told him, telling him not to pay the fee in a hurry, but to complete the examination first. After hanging up the phone, Su Chiu looked at the 200 yuan in his hand and was speechless. MaleProtagonist and his wife ran away. However, he left money for medical treatment very simply. See if there is a phone number left. Make a call. Su Chiu said. He had a bad feeling. This system is similar to that of Conan, where patients are given whatever skills they are given, but at this time, the patient most likely to develop severe pancreatitis ran away. Okay, I'll go take a look. Chen Xiao didn't dare to delay and hurriedly ran errands. However, less than half an hour later, the emergency siren of an ambulance came from the emergency department. Beep beep. Chen Xiao pushed open the door and walked in with an anxious look on his face. Teacher, bed 35 is back and is in the ambulance now. Su Qiu is on the phone at this time. He finished his last words. Director Jiang, please prepare beds in advance. There may be a patient with severe acute pancreatitis who will be admitted to the ICU soon. After hanging up, Su Qiu stood up, grabbed a red pen and stuffed it into his pocket, and said calmly, let's go, save people. Chen Xiao stood blankly at the door, staring at Su Qiu. At this moment, Su Qiu's figure stood against the blazing afternoon sun. The white coat is like a white shirt, a calm expression, as if he has everything under control. He seemed to be glowing all over. Chen Xiao swallowed. She felt that the teacher at this moment was really handsome. Emergency department lobby. After Ma Pingchuan was taken off the ambulance, he was quickly transferred to the emergency room. Outside the emergency room, Ma's wife burst into tears and kept begging the doctor to save her husband. On the emergency bed, Ma Pingchuan was sweating profusely, his face was distorted, his eyes were about to pop out of his sockets because of the severe pain, and veins on his forehead were bulging. He kept swearing and roaring in a low voice. This pain was like a needle, piercing from the lower abdomen, along the large intestine, piercing the duodenum, pancreas, and stomach, and then branding the entire back with a red-hot iron. The sharp pain swept through his body in an instant, and finally it was like a dry hand holding his heart. Bang! He felt as if his heart was clenched, and his myocardial cells were squeezed crazily, squeezing out drops of blood. In extreme pain, Ma Pingchuan had a feeling of dying, and the fear of death flashed in his angry bull eyes. Everyone in the emergency room was panicked. The patient's blood oxygen is rapidly decreasing. The heart rate has soared to over 180. Quick, oxygen, is Dr. Su here? The patient on the bed had very grim vital signs. To put it bluntly, he was not far from death. At this moment, the same person appeared in everyone's mind, that handsome face. At this moment, the crying of Ma's wife outside the emergency room stopped abruptly. Then, the door was pushed open, and at the same time, another voice sounded. What are you doing? Establish 2 intravenous channels, prepare Tynan and ulanastidine, and prepare bedside plasma filtration. This voice was like a warm spring breeze, blowing away everyone's anxiety in an instant. However, before everyone could be surprised, Ma Pingchuan on the emergency bed suddenly made a move that everyone did not expect. Chapter 82, It turns out that suicide for love is not an ancient rumor. You are listening at novelfull.audio. Bang! Ma Pingchuan struggled and fell to the ground. The severe pain in his abdomen and back made him feel no pain when he landed. Ma Pingchuan banged his head against the ground to relieve the severe pain in his body. He gasped for air, his voice was like a beast with a pierced throat, and he said hoarsely, I was wrong. Doctor, I was wrong. It hurts. Save me. Su Qiu touched the 200 yuan in his pocket and sighed in his heart. He said to everyone, save people. Epinephrine 0.5 mg 4 push. Methazone 10 mg slow 4 push. At this point, Su Qiu glanced at the door. Chen Xiao immediately understood what was meant and asked Ma's wife who was supporting her, Dr. Su wants to do several tests. What do you mean? Do it all. We have money, we have savings. Su Qiu nodded, and said in a steady voice. In addition, do a blood gas analysis immediately to check acute blood and creatinine. And do a serum amylase, serum lipase and blood sugar. Check. Outside the emergency room, Chen Xiao comforted Ma's wife. Ma's wife burst into tears and felt very regretful. She said, it's all my fault. I shouldn't have indulged his stubborn temper. We should have listened to the doctor. But it was too late to regret now. Chen Xiao sighed deeply. She didn't respond to Ma's wife's words, but said, don't worry, Dr. Su's medical skills are very good. When the test results come out, it should be confirmed. Although she was still an intern, but after following Su Qiu for a while, Chen Xiao's progress was also unusually fast. For example, you can't be too sure. Chen Xiao did not say that Su Qiu would definitely be able to save the patient, but changed the subject and said that the test results would confirm the diagnosis. Of course it can be confirmed after the test. A few minutes later, Chen Xiao's face showed visible joy. He's saved, the shock has been corrected, and his life is saved. Ma's wife leaned against the wall and breathed a sigh of relief. Later, the patient's test results came out. Su Qiu's most worried thing still happened. Comprehensively examining various tests, Ma Pingchuan was diagnosed with severe acute pancreatitis. The pancreas is an organ located in the upper left abdomen. It has two functions. First, responsible for digestion. Pancreatic juice is the most important digestive fluid in the human body. It also plays the most important role in digestion. Second, regulate blood sugar. At this time, Ma Pingchuan's pancreas has lost almost all its functions and is in an extremely critical state. To put it bluntly, his pancreas digested himself. Afterwards, it will also cause systemic inflammation and lead to multiple organ failure. There are also acute gastrointestinal bleeding, intraperitoneal bleeding, severe infection and even shock, etc. Any of these is enough to take the patient's life. After the rescue, Su Qiu did not let Ma Pingchuan return to the ward. After deteriorating into severe acute pancreatitis, Ma Pingchuan could only rely on the life support technology of the ICU to survive. Apart from this, there is no other way to survive. Either transfer to the ICU, wait for further examination and joint consultation, and then confirm the treatment plan given the patient's current condition. At least need to stay in the ICU for a month. The minimum cost is 500,000. Su Qiu got straight to the point and made it clear. In the rescue room, Ma Pingchuan, Ma's wife and a room of medical staff were relatively silent. Su Qiu waited quietly. The medical staff did not speak either, staring at all this in silence. They have seen too many separations of life and death, and, in the face of illness, fragile promises, family affection, and love, some people say that in the corridors of the hospital, there are people sleeping who are more pious than in temples. These people have more sincere prayers in their hearts than in churches. This is true. What is more common is the cruel reality and the human nature torn apart by suffering. Wife. Suddenly, Ma Pingchuan on the bed shouted loudly. The thin wife of Ma moved over and looked at her husband with tears in her eyes. Ma Pingchuan's voice was hoarse but high-pitched. He wiped his eyes and said, "Don't treat it, we won't treat it. If your man dies, he will die. I'll leave the money to you. It's more than 300,000 yuan. Go home and find a good man. Fuck, my woman will be sold to other men." Everyone sighed. If it progresses to severe acute pancreatitis, if it really needs treatment, a large part of the patients will often lose both their money and their lives. The person is gone, and the family is also heavily in debt. Although giving up treatment is cruel, it is the most rational approach at the moment. At this time, Ma Pingchuan had already made this rational decision. He even wanted to pull out the tube, not even leaving his wife the last chance to choose, but suddenly, Ma's thin wife grabbed Ma Pingchuan's hand. Her voice was not loud, but she said firmly, "Don't pull it out. Let go." Ma's wife's strength was naturally not as good as Ma Pingchuan, who had been doing physical work for many years. Even though the latter was already so fragile, just when Ma Pingchuan was about to tear off his infusion tube, Ma's wife's voice also came, and she said softly, "Pull it out, and after pulling it out, I will find a place to jump down." Ma Pingchuan's hand was suspended in the air. He didn't know how his wife, who was usually obedient, had the courage to resist him today. His heart was struggling, because he realized that if he pulled out the tube, his wife would follow suit. "Don't die. You haven't held a wedding for me yet." At this time, the skinny Ma's wife suddenly held Ma Pingchuan's hand tightly. She rested her head on the bedside of her sweetheart, stared at this rough man again and again, and finally said, "I want to cure you. Even if I try to sell iron, I want to cure you. We will go home together next year. We have been out for a long time. Your parents must miss you too." After coming out of the emergency room, everyone in the emergency department felt inexplicably heavy. Deep down in my heart, I also have more respect for Ma's wife. Being able to spend all your savings gambling on an uncertain future, trading high debt for a slim hope of survival, this is a love rumor that only exists in books and songs. Alas, reason has lost to sensibility. I don't know whether I am happy or sad. The patient's wife has already been contacting her family. She seems to be selling off her dowry and old house. Having such a wife makes this life really worth it. But reality is reality. Most people have lost their money and money. Everyone sighed one after another. Their loyal love has experienced the test of human nature, sickness, but will not pity anyone. Severe acute pancreatitis is an insurmountable mountain that stands in front of all doctors. Like the god of death, it harvested countless amounts of money and took away lives one after another in the despair and tears of families. Alas! Someone sighed heavily again. However, just when everyone was depressed to the extreme, a calm voice suddenly sounded. Chapter 83 Academician Chen's favorite student, Step-by-Step Therapy. You are listening at novelfull.audio. Who is in charge of this patient? Ahead, Su Chiu stopped and asked in an unhurried tone. It's Dr. Chen Jia. Tell her to turn the patient over, Ma Pingchuan, I'll take over. After leaving these words, Su Chiu left without looking back. Only people with shocked faces were left. Dr. Su can actually handle severe acute pancreatitis? This is the most critical acute abdomen in gastroenterology, with a mortality rate as high as 40% and a high chance of various complications. Soon, news spread throughout the hospital that a patient with severe acute pancreatitis was admitted to the emergency department. This is a serious disease that can easily kill people. Therefore, the hospital urgently notified the whole hospital to hold a general consultation in half an hour. In the Department of Gastroenterology, many doctors felt their hearts skip a beat after seeing another case of severe acute pancreatitis. Why are you here again? Last week, we admitted a patient with severe acute pancreatitis. The director personally took action, but the patient still died in the end. I heard that Academician Chen's student is performing a surgery in our city. Can you invite him to come over and perform an operation? Yes, Academician Chen is a top expert in the field of pancreas and intestines. Chen's pancreaticoenterostomy has created a new technique for pancreatic surgery. His student's words may be able to save this man. After receiving the news of the hospital-wide consultation, Director Xiao from the Department of Gastroenterology immediately thought of Academician Chen's students. He quickly asked the medical department to contact him. Soon after, the medical department responded. Professor Gao Peian said that he specializes in robotic duodenum and total resection of large liver cancer. Severe acute pancreatitis is not his area of expertise. However, he can come and participate in post-operative suturing. Gao Peian is Academician Chen's favorite student. I am 52 years old this year, and I am either flying knives or on the road to flying knives. This time, he had just completed a large liver cancer resection at the Municipal People's Hospital, and Linhai No. 1 Hospital happened to catch up with him when he was free. Director Xiao slapped his thigh. Okay, how much does it cost there? 3,000. Director Xiao felt a little itchy after hearing the quotation. Just from the flying knife surgery, the other party had probably made 10,000 or 20,000. To make extra money after finishing the work, drop by and spend 20 minutes doing a Chen's pancreaticogenestomy, and I'll quote you 3,000. But by chance, the other party has the qualifications of a lion to open his mouth. Chen's pancreaticogenestomy is the best anastomotic method in the industry. Currently, doctors specializing in hepatobiliary, pancreatic and other fields are studying this suture technique. Nowadays, the only people who can really master this technique are the doctors from Academician Chen's hospital. There are no experts in this technique like Linhai No. 1 Hospital. Therefore, they can only practice on it. Quality surgical videos. Chen's pancreaticogenestomy is naturally difficult to achieve, spending 3,000 yuan to hire an on-site teacher so that all doctors in the general practice have the opportunity to learn is quite cost-effective. Director Xiao thought about it for a while, and finally nodded. Who said we don't have an expert on Chen's pancreaticogenestomy here? Prepare a car and pick up Professor Gao. On the other side, Ma Pingchuan has been transferred to ICU for monitoring, and a dedicated person is closely observing changes in his condition. Includes general condition, vital signs and abdominal conditions, etc. In addition, there are dynamic analysis laboratory test results such as white blood cell count, hematocrit, blood and urine amylase, electrolytes, blood sugar, BUN and creatinine, carbon dioxide binding capacity. After urgently obtaining various examination data, Director Jiang took the results and prepared to participate in the joint consultation in 10 minutes. The consultation was finally scheduled in the emergency department. Medical record display, report on inspection results. After a series of processes, the most intense discussion session entered. Director Xiao of the Department of Gastroenterology frowned and said, the patient underwent endoscopic ultrasound and no common bile duct stones were found. This is good news. However, the patient's TG level is too high and lipid-lowering treatment must be performed as soon as possible. If conditions permit, blood purification should be done first. The director of the hepatobiliary department said, first use gastrointestinal decompression, proton pump inhibitors and pancreatic enzyme inhibitors. The patient is in so much pain that we must also pay attention to the patient's subjective feelings. Director Jiang from the ICU said, now the patient has signs of respiratory failure. In addition, the patient also has intra-abdominal hypertension and is rated as a high-risk disease. Putting aside everything else, intra-abdominal pressure monitoring must be done before treatment. I am afraid he will develop abdominal compartment syndrome. It's really not possible to try non-invasive ventilation for a short period of time. Otherwise, we have to go to ECMO. The discussion became more intense, and eventually, a surgical plan was discussed. Director Xiao, who is still from the Department of Gastroenterology, spoke. He said, we have invited Professor Gao Peian, a student of Academician Chen, to come over. He also agreed with the surgical plan proposed by our department, percutaneous puncture drainage, visual endoscopic assisted debridement and drainage, and a step-up treatment plan until the final surgical debridement and drainage. After saying this, the conference room became quiet. Everyone said they had no objection. On the one hand, Professor Gao Peian's name is well known in the Department of Hepatobiliary and Pancreatic Surgery, and Academician Chen student has given him a layer of gold. On the other hand, Director Xiao proposed a widely used surgical plan in clinical practice. First, percutaneous puncture. If it doesn't work, do endoscopy. If it doesn't work, the last option is to open the abdomen and perform debridement directly. Severe acute pancreatitis means that the pancreas is completely necrotic, causing complications including organ failure and severe infection. The treatment method is naturally to clean up the necrotic tissue. The three-stage step-up therapy is impeccable. At this moment, a young voice broke the silence in the conference room. Su Qiu stood up, and his face remained unchanged in the face of the stares of many directors. He said slowly, ECMO is not used. The ECMO startup fee is 100,000 yuan, and the subsequent daily cost is also around 10,000 yuan. The patient's family really can't afford such a luxury. Step-up therapy is also not advisable. Percutaneous puncture is definitely not feasible. Endoscopic debridement and drainage treatment does have the advantages of minimally invasive, complications, and low mortality. However, this operation requires repeated debridement. The fatal problem it brings is increasing the number of hospital stays and costs, although the risk of surgery via the abdominal route is high. But as long as the surgery is effective, the patient can be out of danger and transferred to a general ward after staying for about a month. But minimally invasive endoscopy requires repeated puncture and cleaning to gradually expand the sinus tract. The number of days in the ICU will soar to more than 2 months, and the cost of surgery will also rise. The people present were all experts, and they could hear what Su Qiu meant from his 2 sentences, but at this time, Director Xiao stood up again and asked. Su Qiu, you have overlooked the most important issue. Chapter 84. This knife is a perfect mechanical memory. You are listening at novelfull.audio. If this is the choice, the patient does save money, but who will bear the risk? The mortality rate of severe acute pancreatitis is very high. This is only achieved with the support of delayed and selective surgery, somatostatin, early enteral nutrition and continuous blood purification, which barely reaches about 20–40%. And now, the patient's condition is not optimistic, almost like forcing a duck to climb a tree. At this time, high-risk routine surgery is still carried out. Su Qiu, do you want to end your medical career? Director Xiao said the last sentence with a tone of regret. Everyone present knew Su Qiu. It is also understood that Su Qiu frequently performed major operations in various departments and has strong surgical skills, but it is impossible for him to handle even severe acute pancreatitis, right? However, at this time, Director Zhang's phone suddenly rang. He took a look and quickly picked it up. After a moment, he put down the phone, his face pale, and said, "The patient has developed septic shock. The condition has worsened. If early surgery is not performed, the patient will suffer from multiple organ failure and the surgery cannot save him." That everyone's face changed at the same time. Wang Ping was still decisive. He quickly walked to Su Qiu, questioning in his eyes, and asked, "Are you sure?" Su Qiu nodded, "Yes." "Okay, then arrange an operating room." Wang Ping seemed to have gotten used to this scene. "It's good to be a tool man." At the end, he added, "I will bear the consequences of the operation." Director Xiao and others were going to say a few more words, but after hearing the last sentence, they kept silent. Just curious in my heart, why does Su Qiu have such trust from a director? Last week, a patient with severe acute pancreatitis died under Director Zhao's hands. You can imagine how difficult it is to save him. In the meeting room, Director Xiao watched Su Qiu and others leave in a hurry. At this moment, he suddenly remembered something, and he hurriedly said, "Don't worry, Professor Gao hasn't arrived yet." Preoperative conversation and signature. An hour later, Ma Pingchuan was pushed into the operating room. Patient diagnosis, point 1. Severe acute pancreatitis, point 2. Septic shock, point 3. Abdominal infection, planned surgery, pancreatitis debridement and drainage plus Chen's pancreaticogenostomy, preoperative preparation, point 1. Strengthen monitoring, active fluid replacement, and organ function support, 2. Improve systemic condition, intravenous nutrition, and strengthen anti-infection, 3. Imaging examination to clarify the anatomical location of the abscess and determine the surgical route. Before the operation, Director Xiao called Gao Peian. Gao Peian said slowly, "Young man, don't be in a hurry. It will take at least an hour and a half to do the debridement and drainage. It only takes me 40 minutes to get there from here. I can make it in time. I'll have a cigarette first and I can make it in time. Professor Gao, please come earlier and give me some guidance on the debridement surgery." Gao Peian raised his eyebrows. "It will cost extra. The key to the success of the operation is the debridement. If you can come earlier to check, the success rate of the patient's operation can be greatly improved." Gao Peian took a puff of the cigarette, extinguished it, put the remaining half back into the cigarette box, and said while blowing smoke rings, "Okay, I'll be right over." Director Xiao was relieved. Thank goodness Professor Gao is an expert with medical ethics. Operating room, supine position, general anesthesia. Ma Pingchuan soon became motionless. The rough man who used to carry a few cement slabs was now pale and thin, with shriveled cheeks and sunken eye sockets like a mummy. If it weren't for the heart rate and breathing on the monitor, no one would have thought that the person on the operating table was a living person. "Everyone is here." Wang Ping glanced and saw that there were not too many people in the operating room. He frowned immediately. In the emergency department, doctors such as Chen Xiao, Wang Fan, and Yun Mei heard that Su Qiu was going to have another operation, and they signed up bravely, hoping to get a chance to observe. Wang Ping considered that, this operation, the doctors in the emergency department are not needed. It is better to give more opportunities to the people in the digestive, hepatobiliary and pancreatic departments. In the end, where are the people? He looked at Director Xiao and frowned. Aren't the doctors in your department supposed to come here to learn? Why didn't they come? Director Xiao showed a puzzled expression first, and said as a matter of course, "Professor Gao hasn't arrived yet." Wang Ping stopped talking. At this time, everything was ready in the operating room. Su Qiu ignored the others and gently grasped the scalpel, every bit of understanding brought to him by the perfect pancreatitis debridement and drainage. The mechanical memory engraved in every muscle fiber. At this moment, all merged with the knife in his hand. He opened his eyes and said calmly, "The operation begins." At this moment, everyone's heart tightened, and they quickly changed to a focused look and entered the state. A conventional upper abdominal arc incision, incised the abdominal wall layer by layer. then, open the lesser omentum sac and retroperitoneum, and enter all pancreatic necrosis and fluid accumulation areas. Preoperative imaging shows that Mtlno's pancreatic necrotic tissue and exudate accumulate in the lesser omentum sac, some others are in the pancreatic head, anterior, pancreatic and other areas. It's very complicated. You need multiple approaches to find all the necrotic areas. Director Xiao said with emotion. This operation was a bit difficult for him to perform. Without a solid foundation in gastroenterology surgery, it would be difficult to find all the necrotic areas, let alone debridement. However, Su Qiu seemed to have not heard it. He made a cochlear incision to free the back of the pancreatic head. The first necrotic area was successfully opened. Director Xiao was amazed, so fast. He focused a little more and stared at Su Qiu's scalpel. Under the shadowless lamp, the knife moved again. Looking at the location, Director Xiao judged that it should be intended to cut off the gastrocolic ligament from the greater curvature of the stomach outside the gastroepiploic vascular arch to enter the second area. However, the patient's abdominal cavity has already developed a high degree of inflammatory edema, various anatomical structures are blurred, and there are necrotic black liquids, gray-yellow substances, etc., which are difficult to distinguish. Director Xiao looked embarrassed and said, "This is very difficult. At least we have to clean it first, and it will take 7 or 8 minutes to locate it, right?" "Found it." Su Qiu's voice suddenly sounded. His knife was fast and accurate. In the blink of an eye, he cut off a ligament that was stuck together by various substances and could not be distinguished from its original shape. The second area was successfully opened up. Then the third area, Su Qiu found the root of the mesentery again miraculously, and cut off the transverse colon mesentery at the left trites ligament, and the most important omental sac appeared in front of him. As the 3 necrotic areas were exposed, a foul smell rose with the heat, and the disgusting smell penetrated everyone's nose. Everyone looked into the patient's abdominal cavity again, and their pupils suddenly shrank and their faces changed drastically. Chapter 85 I am blind, you are a rubbish hospital. You are listening at novelfull.audio. Under the shadowless light, the patient's abdominal cavity was simply miserable. A large amount of gray-yellow, brown-green and pale red substances are intertwined, mixed with gastric contents, pancreatic dissolved tissue, various necrotic products, and even regurgitated feces. At this moment, it is constantly rolling and stirring with the peristalsis of the patient's intestines. It's over. It's worse than the patient last week. Director Zhao's expression changed slightly, his hands were shaking. The family members of the deceased patient still vividly remember the scene of them kneeling at the door of the operating room and crying. Now he encountered a more difficult patient. However, the next moment his expression was replaced by shock. In the surgeon's position, Su Qiu was still immersed in the world of surgery. He quietly held the oval forceps and used blunt dissection to remove the pancreatic necrotic tissue, while the other hand quickly ligated and cut off the strong fibrous connections, neat and clean, as if silky art. Director Xiao finally understood what Wang Ping said before the operation. He quickly shouted to the circulating nurse, "Quick, tell the doctors in our department to stop being nagging and get on the operating table immediately." Wang Ping glanced at Director Xiao with contempt. If I had known this, why bother in the first place? The operating room was bustling with activity, and at this time, outside Linhai No. 1 hospital, a hospital car parked at the entrance of the emergency department. Wearing a pair of gold-rimmed glasses, Gao Peiyan got out of the car with Ma Pingchuan's medical records in his hand. He was greeted by He Hai. "We're all waiting for you over there, Professor Gao. Has the operation started?" Gao Peiyan asked as he rushed to the operating room. He Hai nodded. "It started more than half an hour ago." Gao Peiyan shook his head and said regretfully, "It should be an elective surgery, but there is nothing we can do. The patient can't delay it." "By the way, what is the patient's surgical plan?" He Hai thought for a while and replied, "Routine pancreatitis debridement and drainage." Gao Peiyan's footsteps suddenly stopped, his eyes widened, and there was a trace of anger on his expression. "Routine surgery? Who asked you to do this?" He Hai explained the reason. Gao Peiyan sighed. "Patients can't take risks if they don't have money. If something goes wrong, if we start a lawsuit and find out that you didn't use the escalation plan, the hospital must be at least partially responsible." But he couldn't be too harsh on anything. A penny stumps a heroic man. Routine surgery is risky, but if it fails, there is no need to spend money on the ICU in the future. At least 10,000 or 20,000 patients died suddenly. Many operations were successful, and a month's stay in the ICU cost 4 to 5 million. As for the escalation plan, the patient will not die easily. Each minimally invasive surgery cleans up a little bit, can't die, but the recovery process is also very slow. On the lower side, the cost of monitoring is 500,000 to 600,000 yuan, and the patient will die after more than a month of treatment. If the patient can tolerate multiple endoscopic debridements, the final cost can even reach 1 million. The family can't afford it and they want to save their lives. Apart from routine surgery, what other options are there? Your hospital is very good. Thinking of this, Gao Peiyan couldn't help but praise. His impression of Linhai No. 1 hospital was much better. Think about the patient and dare to take responsibility for yourself. This hospital, not to say it will be famous all over the country in the future, but at least it is a hospital worthy of the words, saving lives and healing the wounded. After the operation, I will give a free lecture to the gastroenterology department of your hospital. The content is Chen's anastomosis created by my teacher. Gao Peiyan decided to give this kind of conscientious hospital some help as much as possible. I would like to thank Professor Gao on behalf of Director Xiao. Well, how long has it been since Director Zhao's surgery? Is the cleaning halfway through? He was stunned. Director Xiao. He is not the surgeon. Huh? Is there anyone else in your hospital who can perform this surgery? Gao Peiyan was a little surprised. The chief surgeon is Su Qiu. Su Qiu. Never heard of it. Newly promoted director. No, he's a resident in our emergency department. Gao Peiyan slammed the medical record in his hand to the ground and cursed. What the hell? Does the resident perform this surgery? Thankfully I thought your court had a conscience, but this is a waste of human life. I guess I was mistaken. After that, he turned around and left. I hurriedly stopped him. Professor Gao, this resident doctor is not an ordinary resident doctor. Can a resident doctor make a difference? Professor Gao, the 3,000 yuan. Gao Peiyan's step stagnated. He turned and walked to the operating room. He felt disgusted with Linhai No. 1 hospital and said angrily, I'm blind. After this operation, your hospital will be blacklisted. At this time, a large group of people had gathered in the operating room. The doctors from the Department of Gastroenterology and Hepatobiliary and Pancreatology all stretched their necks and stared intently at the surgical site. From time to time, someone made a sound of admiration. Now, under the shadowless lamp, the abscess tissue is wrapping the pancreas everywhere, and there is high-grade adhesion edema around it. This makes every exposure of necrotic tissue difficult. Every time a stinking fluid is aspirated, a tricky approach must be found. However, Su Qiu can always find an incredible way to solve problems quickly. Finally, all necrotic areas have been debrided. He placed a silicone flat drainage tube along the entire long axis of the pancreatic bed, passing behind the hepatic flexure and splenic flexure of the colon and out of the lateral abdominal wall. After completing all this, he reached for the suture needle. Director Xiao paused and said, It seems that someone was called to do Chen's anastomosis. Su Qiu looked up. That Professor Gao? Yes. Su Qiu asked, wait for him. If it was before, Director Xiao would definitely say that he had to wait for Gao Peiyan to come, but at this moment, he couldn't get hard in front of Su Qiu. He hesitated and said, It's all right, Dr. Su, if you can sew, try to sew it. Yeah. Is the reaction so flat? Director Xiao was a little confused. Are the young doctors nowadays too strong in psychological quality? In the abdominal cavity, the curved needle in Su Qiu's hand did not move at all, and then suddenly shook. The next moment, the first suture was sewn in from the outside of the intestinal wall, then it was spun in an S shape, and then penetrated the surface of the remaining pancreas, and then penetrated the pancreas and sewed out. Director Zhao's eyes widened. He opened his mouth wide, and blurted out, This is Chen's pancreaticogynostomy. He subconsciously said, This is too difficult, no one in our hospital can do it, you just use the conventional procedure. But his words were interrupted by Su Qiu's coherent movements, one needle after another that almost left an afterimage. This. How can this technique be so skillful? Wang Ping tilted his head. Huh. What do you mean by using the conventional procedure? Director Zhao's face was full of shock, and he said in astonishment, using the conventional procedure is not worthy of Dr. Su. Dr. Su should use the most difficult Chen's pancreaticogynostomy. How can it be done so well? At this moment, heavy footsteps came from the passage outside the operating room, the voice stopped at the door of the operating room, and Gao Peian, who had completed the aseptic preparation, walked in with anger, seeing the doctors in the operating room, but the main surgeon was a young face. He was even more furious. It's really a resident doctor. I thought Linhai First Hospital had a conscience, but it turned out that they found a resident doctor to take the blame for the hospital. He suppressed his anger, quickly shook out the surgical gown, and put on the clothes with the help of the circulating nurse. His voice was shaking with anger. Madman, everyone in your hospital is crazy. Before he finished speaking, Gao Peian suddenly felt a chill on the back of his neck. Chapter 86 A Chance to Rise to the Top. I don't care. You are listening at novelfull.audio. The circulating nurse's eyes were cold. He said angrily, you just came here to observe the operation. I didn't bother you, but you started scolding me first. Gao Peian was stunned and understood. The nurse didn't recognize him and thought he was here to do the surgery. Gao Peian didn't bother to argue, quickly put on the surgical gown and walked to the operating table. The doctors all knew Gao Peian. Everyone wanted to say hello, but when they noticed that Gao Peian's eyes were murderous, they all shut up and moved out of the way. Wait until you get closer. Director Zhao also noticed the movement behind him. When he looked back, a smile suddenly appeared on his face. Professor Gao, are you here? Seeing Director Zhao's brilliant old face, Gao Peian became even more angry. He said with a livid face. Let the resident doctor take the blame, but you, the director, have shied away the responsibility. While speaking, Gao Peian glared at Su Qiu before turning his eyes to the operating area. The next moment, his scolding stopped abruptly. Gao Peian opened his eyes in confusion. Under the field of surgery, Su Qiu quickly sutured the stump of the pancreas with 3 non-absorbable sutures in mattress style, then, at a distance of 1 centimeter from the pancreatic resection edge. Insert the needle from the cranial edge, from ventral to dorsal, and sew through the pancreas, then, insert a needle 5 centimeters from the edge of the cavity incision from the distal end to the proximal side, and suture the posterior wall of the intestinal loop at the seromuscular layer. Is this Chen's anastomosis? Gao Peian swallowed, his face was full of disbelief, his voice was stuttering, and he said, who are you as a teacher? This method, with ease, every stitch is as precise as if calculated by a machine program. As the stitches weave in and out, the hands are like graceful dancers. Gao Peian saw the shadow of his mentor, Academician Chen, in Su Qiu. Only the founder could play Chen's anastomosis so easily and freely. At the same time, beside the operating table, Wang Ping, Director Zhao and others were observing Gao Peian's expression. Seeing the shocked look on the other party's face, everyone felt a sense of satisfaction in their hearts. Who said that Linhai No. 1 Hospital is not capable of Chen's anastomosis? Director Zhao winked and said with some uncertainty, Professor Gao, how did the resident doctor perform Chen's anastomosis? Gao Peian was still in shock. You call this a residency? Covering his face, he would even think that his teacher was on stage in person. He took a deep breath, with an expression as if he had seen a ghost, and said, how come there is such a doctor in your hospital? What is his relationship with the teacher? Director Zhao and others were very surprised. Gao Peian actually gave such a high evaluation. On the other side, the operation finally came to an end. Su Qiu completed the third U-shaped transverse anastomosis, and then gently pulled. When the remaining pancreas slipped neatly into the intestinal cavity, Su Qiu tied the knot again and the anastomosis was completed. He put down the stitches and said calmly, I have read many documents and surgical videos of Academician Chen. It's gone. You have practiced Chen's anastomosis to this point by reading literature and videos? Gao Peian didn't believe it. Su Qiu nodded lightly. yes. After that, he continued to clean up the abdominal cavity, replaced the sutures with different materials and diameters, sutured the abdominal wall in sequence, and closed the abdomen, and at this time, Gao Peian finally noticed that the patient's abdominal cavity was also extremely clean. Is this the abdominal cavity of severe acute pancreatitis? Gao Peian was dumbfounded. The scene in front of me is simply cleaner than mild pancreatitis. He turned his head and stared at Su Qiu, his eyes full of disbelief. The pioneering Chen's anastomosis, the unconventional pancreatic debridement, can all of this really be mastered by a resident doctor in his 20s? The operation ended in 1 hour and 3 minutes. As the nurse's voice sounded, everyone came back to their senses from the operation. Oh my God, it's done. Dr. Su actually knows Chen's anastomosis, and the demonstration is similar to the one shown in Academician Chen's teaching video that Corey paid a lot of money to buy. Let's not talk about it for now. Dr. Su did a great job cleaning. Yes, with this technology, we can support a specialized surgical team just for debridement of pancreatitis. Director Xiao was also pleasantly surprised. He didn't expect that Su Qiu actually completed the operation. After the necrotic pancreas was cleaned and the contaminated abdominal cavity was restored, the most dangerous factor in MaleProtagonist was removed. With the intensive care capabilities of Linhai No. 1 Hospital, the patient's life is already almost certain. At this moment, Gao Peian suddenly looked at Su Qiu, without concealing the admiration in his eyes, and said, Su Qiu, you have put so much effort into Chen's anastomosis, I can recommend you to go to the Magic City and follow me. Learn from our teacher, Academician Chen. Hearing this, everyone's eyes showed envy. Academician Chen. This person is a leader in the field of liver, gallbladder, and pancreas. Being able to become his disciple is destined to become an authority in the field in the future. It is not an exaggeration to say that he is on the rise. However, Su Qiu seemed to have no reaction. He looked at the rankings of his Chen's anastomosis surgery. Linhai No. 1 Hospital ranked 1, Linhai City ranked 1, Baiyun Province ranked 1, Daxia Kingdom ranked 3, and Global ranking, 6. Then, he shook his head silently and said, No, I'm used to being in Linhai First Hospital. Gao Peian stopped him. Think about it carefully. If you want to achieve something in the field of hepatobiliary and pancreatic, you can't avoid Academician Chen. This is a good opportunity. Su Qiu took off his surgical gown and walked out of the operating room. In the end, he only left a back view to everyone, and a sentence came slowly, I just did an operation by the way, I'm not very interested in hepatobiliary and pancreatic. Fuck. Not very interested in hepatobiliary and pancreatic, and then solved severe acute pancreatitis with a very high mortality rate and extremely poor prognosis, and mastered the Chen's pancreaticogenostomy that countless doctors coveted. Everyone widened their eyes, with disbelief written all over their faces. After the operation, Director Xiao immediately found Su Qiu. He was very excited, and he had lost all the dignity of a director. He rubbed his hands and said, Dr. Su, the video of the operation. Su Qiu understood what he meant and said, you can keep it for teaching. Director Xiao's old face immediately broke into a smile. He asked again, in addition, Su Qiu, can you explain Chen's pancreaticogenostomy to our department? This technology is expected by all the hepatobiliary and pancreatic doctors in the country. If more doctors in our hospital can master it, the level of hepatobiliary and pancreatic surgery will increase sharply. Although he was not proficient in this technique, he had a keen eye. It is obvious that Su Qiu's level of this technique is higher than Gao Peian. Otherwise, the other party would not be so shocked that he could not speak. At the beginning, Gao Peian only came to do a Chen's anastomosis and asked for 3,000. This was just a show of his skills, excluding the cost of air tickets, accommodation and other flying knife expenses. It is conceivable how valuable this anastomosis technique is. As he was talking, another person came in outside the office and cursed Director Xiao a few words as soon as he entered the door. Chapter 87 Dr. Su's surgery is worthy of it. The prognosis is very good. You are listening at novelfull.audio. Old Xiao, you want to show some respect and give 3,000 to an outsider. Seeing that Su Qiu is a doctor in our hospital, you plan to let him do charity. Wang Ping came in with a sullen face. Director Xiao laughed a few times and said shamelessly, we are short of money for digestion, liver, gallbladder and pancreas. In the past few months, the medical insurance has been exceeded, and a lot of bonuses have been deducted. However, we still take out 5,000, how about it? Wang Ping said dissatisfiedly, Professor Gao only charges 3,000 for an operation. Su Qiu gave you a high-definition video of the operation and explained it in person. Besides, he is one of our own and will not hide his personal interests in teaching, so why don't you give him 5,000? Director Xiao touched his head and said with a smile, 10,000, how about 10,000? It can't be more, we are still tight. Wang Ping glanced at Su Qiu. Su Qiu nodded, okay. Wang Ping's expression softened, he put on a smile again, and said, then it's settled. Director Xiao had a dark look on his face, I'm sorry you were just pretending to be angry before. After chatting for a while, Wang Ping and the two finally left, only then did Su Qiu have the opportunity to check the settlement. Congratulations on completing a case of pancreatitis debridement. Surgery rating, S. Congratulations on getting, money *5,000, proficiency *0.5%. Su Qiu was a little surprised, his pancreatitis debridement was perfect, unexpectedly, it can actually be improved. However, the improvement is very slow. It takes about 200 perfect S surgeries to advance to the next level. Perfect surgery is already impeccable, what is beyond perfection? Su Qiu wondered. At this time, there was movement in the system again. Congratulations on completing a difficult task, saving a patient. You've been rewarded, fearlessness in the face of danger. Be fearless in the face of danger, the more important the occasion, the more calm you can remain. And as adrenaline surges, your brain sensitivity and reaction ability will be improved to a certain extent. Su Qiu was quite surprised, this ability is simply prepared for emergency doctors. The emergency room is a place where doctors' adrenaline surges. There are also accidents that occur during surgery, which can also make everyone's heart beat wildly. After acquiring this ability, Su Qiu can handle emergencies more calmly and rationally, and her rescue level should be greatly improved. Ding dong. At this moment, Su Qiu's cell phone received another text message. He opened it and saw that it was remittance information. Suddenly there was an extra 5,000 in the bank card. Perfect surgery, get S rating, an extra monetary reward. This reward is a little special. Before, it was all about surgeries, abilities, and potions. This is the first time the system has rewarded substantial wealth. The system can directly instill even surgical experience, therefore, Su Qiu has no worries about the safety of the money. It seems that it is necessary to improve all the surgeries mastered to the perfect level first. Thinking of this, Su Qiu felt a sense of crisis again. Tonight is destined to be a sleepless night in the operating room. At the same time, over in the ICU, Ma's wife settled Ma Pingchuan and hurried over to thank Su Qiu. Ma's wife wiped her tears and said, Doctor, don't worry, I sold the dowry and borrowed more than 200,000 yuan. I have collected 500,000 yuan. I will definitely not owe money. The doctors in the office were a little surprised. Su Qiu was not surprised. When they refused to be examined before and left the hospital on their own, the two of them specially left 200 yuan for medical treatment. It's enough to see their simplicity and kindness. As the saying goes, every time a dog is slaughtered in a righteous manner, that's probably it. But, if they had listened to the doctor's advice and spent hundreds of dollars on examinations, they would not have developed to where they are today. However, now that the operation is successful, it is considered a blessing among misfortunes. Be mentally prepared to spend money. Su Qiu said, successful surgery is only the first step. In the follow-up, various complications must be prevented and treated, and the patient needs to be cared for another month under the life support technology of the ICU. If you can survive this month without the infection worsening, you will be truly saved, and this is the most important reason why severe acute pancreatitis becomes a money killer. Surprisingly, Ma Pingchuan's recovery effect was unexpectedly good, here in the ICU. Director Jiang and the doctors and nurses in charge of the bed were all shocked. It is indeed the surgery performed by Dr. Su. The prognosis is far better than the average. Everyone sighed. On the first day after surgery, the patient regained strength and could get out of bed. 3 days ago, MaleProtagonist had no infection, no intestinal fistula, and other common complications, and spent the most dangerous 72 hours after surgery. On the 4th postoperative day, blood amylase gradually recovered. On the 5th day after surgery, MaleProtagonist had his first exhaust gas, that is, fart. This means that his intestinal function has initially recovered and he can eat liquid food and gradually return to normal food intake. However, there is still quite some time before we are out of danger, and Su Chiu can only pray that the patient's prognosis will exceed expectations. Dr. Su, last time you acted bravely and saved Director Kong Huixia, you were rewarded. On this day, there was a call from the hospital administrative department. Su Chiu originally thought there was only money. However, after receiving it, he discovered that there was also an honor awarded by a provincial unit. Reward for bravery. In addition, the hospital also issued an award for Outstanding Young Doctor of Linhai No. 1 Hospital, plus a bonus, provincial award, 9,000 yuan, hospital reward, 5,000 yuan. After each visit, Su Chiu had 2 more honors with red seals in his hand, and an additional 14,000 yuan in his card. It seems that there is no shortage of money suddenly. Su Chiu looked at the bank card. He has only been working for more than a month, during which time he paid 10,000 yuan in rent, and now he still has more than 60,000 yuan in his card. As long as he doesn't buy a house or a car, this money is enough for a single young man to live a comfortable life. Just as he was thinking about it, Su Chiu's phone rang. Please take me to the doctor's office in the emergency department. After a while, the delivery boy came up in several trips carrying several boxes of milk and coke, and then moved to the corner under Su Chiu's instructions. There is milk and coke here. If you want to drink, just take it. Su Chiu said. Female doctors and nurses often fed themselves. These things can be regarded as courtesy. Thank you, Dr. Su. Dr. Su just works. You have to keep the money for yourself. Otherwise, how can you buy gifts for your girlfriend? Su Chiu said calmly. I don't have a girlfriend. Hearing this, the smiles on the faces of the female doctors who were already smiling became even brighter. I have a friend who is looking for a boyfriend. Dr. Su, Wang Fan and the others can just drink coke, but you don't want to drink it. It's a spermicide. Wang Fan, who was drinking coke, choked and sprayed all over the table. He cursed and said, don't mention me. Every time you call Dr. Su, you just eat this and that. When you call me, you just do this and that. They are the same people, but the gap is so big. Dr. Su, Wang Fan, there is a shortage of people in the operating room. I call you over at this time. A young nurse stood at the door and announced. Good. Su Chiu and Wang Fan got up at the same time, rushed to different operating rooms, and started busy. After the operation, it was already around 8 o'clock in the evening. When you are a doctor, working overtime is normal. Even doctors with high positions such as Wang Ping and Dean, as long as they are still working on the front line and on the operating table, their off-duty time is equal to the end of the operation. It is common to get off work 2 or 3 hours late, even. It is also possible to perform an operation for 12 to 13 hours, directly to the next day, and then continue to support the whole day. After coming out of the operating channel, the corridor was already lit with white lights, and the dusk outside the window was deep. Su Chiu was already very tired. He was going to take a shower in the dressing room to wash away the smell of disinfectant before going home. As a result, when passing by the emergency department hall, he stopped again and looked up. Helplessly, why did this happen again? Chapter 88. Doctors nowadays have no medical ethics. They are all obsessed with money. You are listening at novelfull.audio. In the hall of the emergency department, 7 or 8 people surrounded a doctor. Su Chiu took a look and saw that the unlucky one was Wang Fan. Wang Fan spread his hands and said, Auntie, the diagnosis is very clear now. It is aortic dissection, and surgery must be performed quickly. That the patient's wife wore a headscarf and had rough skin. At first glance, she was someone who often did farm work. After listening to Wang Fan's words, she asked with tears in her eyes, Doctor, can we not have the surgery? We don't have that much money. Wang Fan felt a little sympathetic. He slowed down his tone and explained, aortic dissection is a very dangerous disease. The most important large blood vessel in the human body is the aorta, and now your husband's aorta is torn. This disease must be operated on, and it must be done as soon as possible. If not, he will die at any time." That the patient's wife was terrified. She asked carefully with tears in her eyes, "Doctor, how much does the operation cost? We have rural medical insurance, can it be reimbursed?" Wang Fan, for rural medical insurance, you have to pay for it yourself first, and then go back to you for reimbursement. Your husband has a more dangerous type A aortic dissection, and the cost of the operation is estimated to be between 200,000 and 300,000. You pay 100,000 first to cover the cost of the operation. We can save his life first, and then consider hospitalization later. The patient's wife's legs softened and she was about to fall to the ground. It was Wang Fan who acted quickly and supported the family members. The patient's wife cried loudly. She searched her pockets for a long time and finally took out the change. All of them were wrinkled 1 yuan and 5 yuan notes, and the largest denomination was 20 yuan. Her voice was shaking, and she cried while saying, We have a drought over there, all the crops have died, and the land at home has also died from drought. We only have this little money left." Wang Fan was stunned, looking at the money in the patient's wife's hand, not knowing what to think. He subconsciously said, "This is too little. The total amount is not even 100 yuan, how can it be enough?" Wang Fan finally softened his heart. He gritted his teeth and said, "Well, auntie, you go and raise money now, just pay 50,000, I will help you apply to the director, and find a way to do the operation first, and save your life first." Su Chiu was a little surprised. If the patient cannot make up the expenses after making this application, the doctor's bonus will be deducted later. If the punishment is more severe, the doctor himself may even be asked to fill the gap. Wang Fan was able to do this, which was very considerate of the patient. However, at this moment, a middle-aged woman rushed out from the crowd and suddenly pointed at Wang Fan's nose and cursed. "How can you be so unethical, doctor?" Wang Fan was stunned. He hadn't reacted to what happened yet. The middle-aged woman squatted down, patted the patient's wife on the shoulder, and shed a few tears. Then she glared at Wang Fan fiercely and said, "You are really losing your medical ethics. If you don't have money, can't you save people first? Doctors nowadays only have money in their eyes. Flying knives cost money, seeing a doctor, various examinations cost money. You are all obsessed with money. Do you deserve the 4 words saving the dying and healing the wounded?" At this moment, on the other side of the corridor, another doctor, Zhou Hua, was walking over with a cold face. There was another contractor behind him, who said in a bossy tone, "Why do you want to treat? We didn't pay you, but you treated him without permission. Now you want to blame us for not paying." Zhou Hua didn't have the good temper of Wang Fan, and he immediately turned his face and said, "You didn't say it a week ago, and now we have saved the patient, and you say you don't want to treat him without paying." The contractor also turned his face away. "Speak some reason, we didn't say to treat him, why did we spend so much money?" Zhou Hua didn't intend to waste words with such a person, but the other party kept blocking him and didn't let him leave. In desperation, Zhou Hua directly called the security guard to pull the contractor away. At this time, he saw Wang Fan again. From a distance, he heard the middle-aged woman scolding Wang Fan for being cold-blooded and having no medical ethics. He was already full of anger, and he was also a powder keg. He came over in 2 or 3 steps and asked, "What's going on?" Wang Fan explained to the patient first, "It's like this. If you don't pay, the management department won't issue surgical instruments, and even anesthetics can't be approved. The pharmacy and equipment management are all paid for before they can give things. Patients are already being rescued on credit." After that, he briefly explained the situation to Zhou Hua. The middle-aged woman didn't listen to Wang Fan at all. She was still nagging, saying, "You only care about money. When I was a child, the doctors in the village paid for other people's medical treatment, and they would save people even if they were hungry. Nowadays, doctors are all bad, and they are full of money." Zhou Hua laughed after hearing this. He said to Wang Fan, "Take out your phone." Wang Fan was a little confused by the scolding, and did as he was told. "Unlock it." Zhou Hua said. Oh. Wang Fan quickly unlocked it. Zhou Hua opened Wang Fan's Alipay account and checked the balance. Very good, it was indeed 900 yuan, so, after he exited, he opened Jibei again. Zhou Hua laughed and said, Auntie, you are right. We should be a wise doctor, but he is a poor doctor with little money. Jibei has a loan limit of 10,000 yuan. I will help him borrow it all. I also have a loan limit of 30,000 yuan. We can show our love together, and we still need 10,000 yuan. Well, you are so caring, and you have made up for the 10,000, and you can use it to treat this aunt's husband. It's only 10,000 yuan, you can't help but give it, right? After hearing this, the patient's wife felt hope emerge from her originally gloomy eyes. She turned her head and looked at the middle-aged woman with pleading eyes. It was this old sister just now who had been comforting her and even crying with her. However, to her surprise, the middle-aged woman's eyes were so angry that she suddenly pushed the patient's wife away and disappeared from everyone's sight. He was still cursing and cursing, having no medical ethics and being full of evil. After people go far away, the patient's wife turned her pleading eyes to the others around her. The onlookers who had criticized Wang Fan before said, "You should sympathize with the patients. It's just such a small amount of money." However, everyone she looked at finally lowered their heads and left here in shame. Zhou Hua smiled sarcastically. He returned the phone to Wang Fan and said, "What kind of medical ethics? In the eyes of these people, medical ethics means that you don't need money, and you even pay people to treat their illnesses. We are just migrant workers. Don't want to support the family." After scolding, Zhou Hua suddenly felt very relaxed. He looked at the patient's wife again and said, "Our hospital will try our best to coordinate with you, but the money, you still have to go back and raise it." The patient's wife shed tears and nodded desperately. At this moment, she finally realized that those standing next to her who seemed to feel the same way were just making sarcastic remarks. Those who truly care about her and her husband. It is precisely those doctors who are said to have no medical ethics and don't pay for treatment. Far away, Su Qiu moved her steps and prepared to leave. If Zhou Hua resolves this matter, there will be no need for him to step forward. There is a charity fund donated by Director Chen in the department. Finance has already prepared for this situation. He doesn't need to worry. But such an incident happened, but it brought back some memories of Su Qiu, and that incident almost cost him his life. Chapter 89. I only have this one daughter, please save her. You are listening at novelfull.audio. In his previous life, he had treated a patient who needed a combined heart and lung transplant. The patient's family was poor and could not afford the medical expenses, so the whole family came to kneel and kowtow to Su Qiu. Su Qiu, who was already wealthy at the time, could not bear it, so he paid 200,000 yuan and performed the operation for free. The operation lasted 13 hours, and after coming out of the operating room, Su Qiu was directly on glucose and ventilator. Later, the patient's family members sneaked into his ward and unplugged his ventilator. If Su Qiu was not just weak and not in a condition where he could only rely on a ventilator to maintain his life, he might have really died that late night. From that day on, Su Qiu understood a truth: it is not that the greater the help given to others, the deeper the gratitude of the other party will be. If this kindness exceeds the limit of the other party's ability to repay, then this powerlessness will turn into ever-present guilt and debt, and even become a painful torment in the heart. At this time, in order to get rid of this spiritual torture, the person who most hopes that the benefactor will die is the beneficiary. At the moment, Zhou Hua handled the conflict between money and life in a very appropriate way. Therefore, Su Qiu did not interfere. He went to the office to get clothes and returned to the operating room. The locker room and doctor's lounge in the operating room are equipped with bathrooms for doctors to take a shower. On the one hand, after many polluting operations, not to mention the outsiders, even the doctors themselves feel dirty. On the other hand, wearing layers of surgical gowns and concentrating on the operation for several hours or even more than 10 hours, even the most handsome hairstyle becomes a slicked back hair, and the hair is all stuck to the scalp. There is really no image at all. Taking a shower before leaving the operating room is also to maintain the most basic appearance. Many medical dramas, even medical documentaries led by the state, have a lot of details that make clinical doctors collapse. For example, in the documentary, a certain academician performed an operation for more than 7 hours. It stands to reason that after such a long operation, not to mention how tired he looks, his beard may have grown a stubble. However, the other person still had a bright look in his eyes and a neat hairstyle. This kind of staged photo that insults the IQ of frontline doctors, in some ways, has also deepened the misunderstanding of doctors among ordinary people. After taking a shower, Su Qiu left the operating channel and heard the emergency hall start to quarrel again. He glanced. In the doctor's duty room, a group of people stood in a crowd, all crying and wailing to save people. There was also a little boy with a tearful face. Kneeling at the door, Su Qiu went over to take a look. What's the situation? Wang Fan pulled Su Qiu aside and lowered his voice. The 40-year-old man in their family fainted. We just rescued him and now have an appointment for an emergency CT scan, but there are 2 patients over there. It is estimated that it will take more than an hour to get the results. 40 years old, man, this means that the person who fell ill is the backbone of a family, or even 3 families. Su Qiu hesitated, not knowing whether he should leave. At this time, Zhou Hua came over and said, Dr. Su, go back and rest first, leave it to me. Su Qiu pondered for a while, then nodded. He still recognized Zhou Hua's ability. Sure enough, not long after, Zhou Hua calmed down the family members. Su Qiu left with peace of mind. Linhai in September has begun to have a hint of autumn, and it is cool. The busy road is full of traffic. There are all kinds of stalls outside the hospital, shouting one after another, and people are flowing. People coming out of the hospital often look very good. They happily buy a midnight snack to reward their stomachs that have been light for a long time. Most of those who enter the hospital are dejected and have no intention of looking at the snack stalls with fragrance. Unlike the vendors at tourist attractions, outside the hospital, most of the products sold are fruits, flower baskets, and various disposable daily necessities. Food is at 2 extremes. Either all kinds of tempting fried foods, such as grilled squid, stinky tofu, grilled wings and shrimp sprinkled with cumin and oozing with oil, or, simply white porridge, steamed buns, etc. Su Qiu was hesitating whether to eat some. A voice with a little joy sounded from behind. Dr. Su. Su Qiu looked back and found Li Shui walking quickly. Dr. Su, are you just off work? As she approached, Li Shui breathed a few times lightly, with a surprised expression. Yeah. Su Qiu nodded. Just finished the operation. Then you must not have eaten at night. Let's solve it here. Li Shui asked. Su Qiu did not refuse, and found a barbecue stall with her to sit down. Soon, the sizzling meat skewers and crispy gluten came up. Li Shui took the initiative to talk about her own things, saying, I just did a congenital heart disease operation on a 2-month-old baby with director who. It's a hard life. Su Qiu took a bite of the meat skewers. It smells a bit good, Li Shui continued. The patient is a lady in her 60s, and she has hired a nurse in her 30s. Su Qiu asked, where is your mother? Li Shui said with some distress, my mother is this lady in her 60s. Su Qiu was a little surprised. There are cases of people who have not reached menopause in their 60s, but they are not common. Li Shui saw Su Qiu's confusion and explained, she was actually in perimenopause, but she was determined to have a baby. Our hospital took advantage of the fact that she was not completely in menopause, and quickly let her ovulate, and did a test tube baby, and finally gave birth to a baby. Her children gone. Her son was bullied in high school and jumped off a building. Her daughter was very outstanding. She finished college in Tiandu, and later was recommended to study abroad for graduate and doctoral degrees. After returning to China, she found a job in a foreign company in Tiandu, and her annual salary was more than 300,000 yuan. As a result, just 1 year after graduation, she got into a car accident when she took a taxi back home, and she died on the spot. Su Qiu sighed. After losing her only child in old age, she finally gave birth to another child, but the child was still a sickly child. If it happened to anyone, it would probably be like the sky falling. Li Shui looked a little lonely, and said, when I went to issue the critical illness notice, this auntie kept holding my hand, signed it tremblingly, and told me, auntie is rich, this child has a hard life, please treat her well. I only have this one daughter. Oh, it was really sad to hear that. Ding-ling-ling. Suddenly, Li Shui's phone rang. After she picked up the phone, she listened for a while, and her face immediately turned cold. After hanging up, she said apologetically, "There are still a few inpatients in the obstetrics department who need me to deal with them. It's not urgent. I'll go back and see them after I finish eating." The two chatted for a while and hurriedly finished dinner. Li Shui returned to the hospital. After returning home, Su Qiu practiced surgery for a while, and went to bed with his clothes on when his body was completely tired. The next day, the daily tasks were refreshed. After getting up, Su Qiu took a look and immediately felt that something was not good. Chapter 90. The professor is shocked. He takes action personally. You are listening at novelfull.audio. Simple task, a case of lower lip plastic surgery. General task, so a Pikachu. Difficult task, get a heartfelt thank you from a peer. The first two tasks are less serious. A dignified emergency doctor, sometimes he performs obstetrics and gynecology surgery, and sometimes he performs male urology surgery. Is that right? Furthermore, it is more difficult to meet these two types of patients in the emergency room than to meet an eel anchor. As for difficult tasks, my heartfelt thanks from my colleagues. The difficulty is probably much higher than the patient's heartfelt thanks. In the emergency department, Wang Ping, He Hai, Wang Fan and others admired Su Qiu more. It has nothing to do with sincere gratitude to Baganzi, unless, encountering an incident like Kong Huixia again, or, turn the tide and help a doctor correct his surgical failure and save his career. What made Su Qiu feel bad was, since the system has given the corresponding task, it means that the hospital may really have figured out something. With worry, Su Qiu came to the hospital. Since the vicious medical incident involving Liang Yongrui, the security measures at Linhai No. 1 Hospital, or hospitals across the country, have been further tightened. There are 4 or 5 security inspection machines lined up at the gates of the outpatient and inpatient buildings, and 4 security guards carrying steel forks are ready to respond. Because the panic over the medical incident has not yet subsided, a police car was parked outside a hospital at this time. Su Qiu took a quick look and entered the hospital through the staff passage. He is not optimistic about the security in the hospital. The hospital has a huge flow of people, especially during holidays, when it is even more crowded. If there is another security check, based on the number of patients in Linhai No. 1 Hospital, the queue may have to go to the other side of the road during peak periods. Therefore, this kind of security inspection measure will only be a cosmetic project after all, and will become a formality in a few days. Congratulations on completing your sign-in at Linhai No. 1 Hospital. Your impact factor is 6.5, the rewards will be greatly increased, and the reward richness will be *6.5. Congratulations. Master-level neuroendoscopic resection of skull-based tumors. Su Qiu fell into deep thought. Generally speaking, the impact factor does not change much, unless Su Qiu went to another department for a major operation, or he handled another case that shocked the whole hospital. Like before, Su Qiu rescued Ma Pingchuan, and the impact factor directly increased by 0.3 in the past few days. Because he had been staying in the emergency department, the impact factor had almost remained unchanged. Why did it suddenly increase by 0.2 today? Only when Su Qiu came to the office did he know the reason. It turns out that his paper passed the review and will be published next month. Wang Ping came over to congratulate him with a very kind smile. Congratulations, your first paper passed without changing a word. Director Yu, who is out of touch, also made a special trip. Before he could say anything, the phone rang. Director Yu said a few words, then excitedly handed the phone to Su Qiu and said, "It's yours." As soon as Su Qiu put it to her ear, an enthusiastic voice came from the other side of the phone. "Dr. Su, I am the editor of Daxia Traumatology and Orthopedics. This paper was really completed by you alone." Su Qiu, yeah. The editor of the journal was still in disbelief. Daxia Orthopedics will not worry about fresh blood in the future. Dr. Su, our journal knows Professor Lin Xie. You know Professor Lin Xie, the most authoritative expert in the field of bone reconstruction. Su Qiu nodded. When Chen Mingxuan's tibia was reconstructed, Lin Xie said it couldn't be done. Su Qiu took off the operation just in front of Lin Xie. "Remember, it's pretty awesome." Su Qiu said. The journal editor pouted. "This young doctor is quite arrogant, and the reconstruction boss is just very good. Have you written a few papers before drifting off?" However, thinking that geniuses always have the capital to be proud of, the editor was relieved. He named the purpose of this call and said, "We intend to help you connect and let you study with Professor Lin. You only need to promise that all future papers will be published in How About Our journal. For any doctor who wants to develop in bone reconstruction, this condition is extremely attractive. Skeleton reconstruction without learning from Lin Xie is just like hepatobiliary and pancreatic cancer without learning from Academician Chen, Lolita without learning from teacher Mao Yu, JK without Mignon, NTR without Hiramitsu Takeda, Go without YD, Made without Mickey Mouse King," but the journal editor was wrong. The person he spoke to was Su Qiu. After hearing Lin Xie's name, Su Qiu's expression was calm and she shook her head and said, "No, thank you." Toot toot. The journal editor listened to the busy signal on his mobile phone with a very surprised expression. He doesn't understand. A fledgling doctor actually rejected an invitation from the editor of a top Chinese journal? It's because Lin Xie has no influence anymore, or is Daxia traumatology and orthopedics not qualified enough? This is too arrogant. Does he really not know Professor Lin's status? That the journal editor was furious. He called Lin Xie and briefly described the matter. After listening, Lin Xie was also a little surprised and said, "A genius with a thesis has emerged in orthopedic reconstruction. How was the operation?" That the journal editor shook his head. "I don't know about that." However, his paper was written in the first draft. Since his scientific research ability is so strong, the surgical level may be terrible. Lin Xie nodded, "Yes. Human energy is limited. For example, He Hai and Director Yu of Lin Hai First Hospital are two typical examples. They are about the same age. He Hai is a surgery fanatic and his papers are a mess, but Director Yu focuses on scientific research and his surgical skills are not very good. Of course, the treatment of the two is also very different. He Hai was promoted to deputy director only a few years ago, while Director Yu has already secured the position of director." Lin Xie thought for a moment and said solemnly, "If it's just a good paper, I don't have much interest here. The current dilemma of bone reconstruction in Daxia is not academic papers, but technology." The editor was a little regretful. "That's a pity. But, that genius was very ambitious and refused our journal to introduce him to you." Lin Xie was surprised. "Such a personality? What's his name? Which hospital is he from?" The editor said, "Lin Hai First Hospital, Su Qiu." "What?" The editor was startled by Lin Xie's suddenly raised voice. Su Qiu. He said in a puzzled way, "Professor Lin, do you know him?" Lin Xie narrowed his eyes and said earnestly, "More than knowing him, there is a surgery that I can't do, and he has done it." Editor. "What? What Lin Xie can't do, Su Qiu did." At this moment, the editor remembered that he had boasted about Professor Chen in front of Su Qiu, and he suddenly felt ashamed and wanted to travel back in time to slap himself in the face. "Send me the paper," Lin Xie said urgently. Soon, he finished reading Su Qiu's paper. His face was a little more excited. The surgical level is impeccable, and the scientific research ability is also amazing. This kind of talent must be won over. That if surgery and scientific research are 0.5 each, then, people who can do both are not simply 1, but 10. This kind of doctor is the real genius who can challenge the limits of human medicine and advance the medical process. After putting down the paper, Lin Xie quickly booked a ticket to Lin Hai City. He wanted to talk to Su Qiu again. At noon that day, Lin Xie turned down all meetings, took a few clothes, and got on the plane directly. However, as soon as he entered the first-class cabin, he met an unexpected big shot.